Hi, everyone. I can't wait for you to hear this conversation that we just had with Dr. Olu Jegede at Cone Health Center for Health Equity. Dr. Martin Luther King Jr. once said, "Of all forms of inequality, injustice in health is most shocking and the most inhumane." That's exactly what we're talking about. Health equity means that everyone has a fair and just opportunity to live the healthiest possible life. So join us, listen in, and find out how we're working to create just that at Cone Health. Hi, and welcome to Authentic Moments. Thank you so much for being here. Today, we are talking about health equity and how we're working to achieve it at Cone Health. So, health equity means that everyone has a fair and just opportunity to live the healthiest possible life. So, today I'm talking to a definite expert in that area, Dr. Olu Jegede. Dr. Jegede, can you just tell us a bit about your professional background and your current role at Cone Health?
Thank you, Nikita, and good morning. Thank you for the opportunity to share with you about health equity. I am board certified in internal medicine and pediatrics, and I currently serve as the Vice President of Health Equity, the clinical care here at Cone Health. So I am responsible in this role for prioritizing and developing clinical protocols to address disparities in healthcare and health outcomes for our communities. So, for me personally, caring for the uninsured and connecting with the marginalized population or individuals in our community is really my passion. So, that is the reason I came to Cone about 8 years ago, and I started off as a medical director for the then it was newly created community health and wellness. And then there we cared for the uninsured, underinsured, and the historically marginalized population.
So you definitely have been at this for quite a while, and this, like you said, it definitely sounds like it is a passion for you. I mean, and what more important thing to be passionate about? I know you've used this quote before, and I think it's important to share it here. The Martin Luther King Jr. quote that says, "Of all forms of inequality, injustice in health is most shocking and the most inhumane because it often results in death." So I can't think of a more important thing to be working toward. And I'm so glad that you're leading the Center for Health Equity. So your leadership for the Center for Health Equity at Cone will definitely be a key component of our Healthy Communities strategy at Cone. Can you give us some background on how the center was formed? I definitely see how you came to this work and why you're leading it, but maybe how can you tell us how the center was formed and when?
Yeah, thanks for that question, Nikita. As you know, Core Health is ensuring that a commitment to both health equity and healthy communities are actually called out in all our system-wide strategy, priorities, and goals. So we're committed now to weaving health equity into the fabrics of our communities. And on this background in FY, I believe was 2022, there was need to create a new structure that will ensure that we do just that. So this structure is to strengthen and to improve the services that we provide in key areas of our communities by identifying and addressing the barriers that contribute to how we treat patients and the outcomes that we see in our communities. So the center was created then, and we have started to bring in individuals from different backgrounds with expertise in different areas like social drivers, like cultural competency, like research and data, and of course the protocols for the clinical care that we will be providing for our communities.
And I like that that we're focusing on that. And you said something that I think is core to it. Yeah, absolutely. There are a number of different things that impact health, but how we treat patients when they come to us has an impact in the community, on the individual and in the community at large. So I think it's really obviously very important that we are honest about that, that we have some part to play in that. So you've been leading this community facing work at Cone for a while, as you noted, and I'm sure that that work has contributed to the vision now for the Center for Health Equity. So catch five and five, that's the vision, right? It is catchy. Catch five and five is catchy, but can you talk about what it really means? What does that vision mean?
Yeah, let me just give a little bit of a background to this. Now we have strong evidence that where you live or individuals where they live, where you love and pray and play actually have a large effect on your health. In addition to so many other attributes that will be traditionally considered important, such as diet, exercise, physical activities, maybe some family history. But then your zip code now determines a lot about how long you actually can live. And this reflects the rate of social vulnerability and disparities with those social drivers, such as quality of food that is available where you live, housing, transportation, like broadband availability, education, employment, and so many other social drivers. This heavily influence the what you just described as health equity, the fair and just opportunity to live as healthy as possible. So now, knowing that, we did a little bit of um, digging deep into what we actually have here at Corn. You see all these in different, I would say, different communities, but then you want to know what is our reality here at Corn Health. We found out that if you go certain area in Greensboro, people have the opportunity to live up to 85 years. And then if you go the other way, it's about 70 years of life. So we have this disparity of up to 15 years in life expectancy. And we think this is not acceptable. We have to call it out. And then we came up with what can we do to bridge the gap in life expectancy. And our bold goal now, from the Center of Health Equity standpoint, is to increase life expectancy in a certain area where they are not living long enough by 5 years and 5 years. So if we do that, we'll be reducing the gap of that 15 years that I just explained. Now, how do we get it done? We think health and wellness live in the community. So we have to be in the communities, educating the communities, being right there with them, screening them, and finding out what are those contributing factors that is limiting their life expectancy. So Catch 5 in 5 actually speaks to collaborative actions towards community health. That is what the catch means. The 5 in 5 is to give 5 years back to our communities in 5 years. So catch 5 in 5 really entails us going in the community and screening everyone that that we see, for hypertension, for diabetes, for cholesterol, making sure that those who are not aware that they have these chronic diseases, that they begin to know and then to mitigate the risk factors so they don't die young. Like the story I always give about Takia, who died at 38 of high blood pressure. That is too young because blood pressure should not be killing people. If you know you have it early and then you treat it early, you can live as long as you want to live. So those are the things that we want to do, and the collaborative part of this shows that we cannot do it alone. We need help with the communities. We need partnership with everyone in the communities, our community-based organizations, faith-based organizations, and all the other health, even all the other healthcare system in our communities, the school system, A&T, university, UNCG, everyone, to collaborate and make sure that we are caring for our communities.
And that's you talk about the collaboration. And realistically, that is literally our mission at Cone, is to be right here with our community, right? So I can't think of a better reflection of that than the work, the Catch 5 and 5 work. Because like you said, we can't, all of that healthcare doesn't happen just inside the walls of our
Yeah.
facilities. I do think it's one of the most shocking things that I heard in the time that I, have been in this community, is that disparity in life expectancy. 15 years in a 5 mile radius is
Yes.
unbelievable. So I think I think that you're actually setting a vision that will give people life back is tremendous. To do some work that impactful, we have to have some order, right? We have to really be structured in our approach. So I know there's a 4C model in the Center for Health Equity. Can you talk about
Yeah.
what those 4Cs are? It's not just a cute phrase, but tell us what the 4Cs are and how that will work with the Center for Health Equity's vision.
Yeah, well, good thing is that you are also one of the forces. So, yes, I'll talk about that. Is the structure I was referring to earlier, the organizational structure that will strengthen and improve the services that we provide. The center will bring, of course, subject matter experts and influencers from a diverse clinical and non-clinical background. So it's not just the clinical piece of it, but it's also non-clinical piece. And then, of course, we have the 4Cs, and I will just mention them, then I will tell you exactly what they do. We have care, we have caring, we have culture, and curiosity. So those are the 4Cs that makes up the the structure of the Center for Health Equity at Cone Health. So the care focuses on identifying priority areas and developing new clinical protocols and procedures that will transform how we take care of our patients and our communities. And this, of course, goes a lot, in different ways. It could be community-based intervention and hospital-based intervention, and of course, in our outpatient area. So care is really heavily clinical. So creating those protocols and ensuring that all our physicians buy into this and seeing all our care through the lens of health equity. Then caring, of course, really is the, I would say, bread and butter of of health equity. And the reason is this, right? So we're talking about historically marginalized communities. And what does that mean? A lot of it has to do with structural racism and the lack of a lot of those things that they really need to stay healthy, which we now call social drivers of health, right? So we're talking about food insecurity, we are talking about lack of transportation, digital access, financial literacy or illiteracy, so many things like that. Caring is ensuring that our patients really are connected to those social drivers, to the need that is because you can have someone with hypertension. As a physician, I will write prescription and say go and get your medication, like the case of Takia, and then of course they don't even have means of getting those medications, or they don't have transportation to go to their PCP, their primary care doctor, or they don't even have yeah, food to eat. So they are making decision between, should I take my medication? And we always say take your medication after food, but there is no food. So So all those things, caring is ensuring that our patients are connected to the care that they need. Then we have culture, which really centers around cultural competency. And I'm glad you are leading that, Nikita, focusing on and ensuring that our providers, feel confident to provide safe care for our patients with cultural humility and sensitivity, And then, of course, we're talking about implicit bias and all the things that you are leading, which is a key part of this work because um, I see some provider will say, "Oh, I don't see color. I treat everybody equally." But equal care does not mean equitable care, you know. And that something is available does not mean it's accessible. So we really need to, kind of train everyone that we need you to see that color, right? We need you to see that color so you can treat that person as an individual, not as a statistics. You don't treat everybody equally because everybody needs individual needs, and then we need to meet individual at the point of their need. Now, the last C is curiosity, which is very interesting because again, we cannot function without data and research, right? So, and data really is to use science to drive our understanding of our communities. So, like we are, going into the community to screen everyone about blood pressure, blood sugar, cholesterol, we can use those data to predict where our patients really live and where they are the people who have high blood pressure, where they are likely to be, and then what is contributing to why their blood pressure is not as controlled as other people, right? And we use those knowledge to create a community-based intervention. So data and research is key. Of course, cultural competency is key. Caring is key, and care. So that is the structure of the center. And I think this is a great way of bringing different subject matter experts together to um, to make the strategy of health equity work really well.
So it's collaborative, and the center is collaborative in both its structure and its execution of the vision, which is really good.
That
I, you talked about curiosity and the significance of data. So obviously, we wouldn't even know that we have this disparity if we were not tracking important data. So we use in the Center for Health Equity what's called a real data, race, ethnicity, and language data. And it has been meaningful to our work, as you alluded to. Um, we Can you talk about some of those ways in which real data was meaningful, like in our pneumonia work, for example?
Yeah, I'm glad you mentioned that, Nikita. So we know now that addressing disparities in either the hospital, clinic, or in the communities, it has to begin with the fundamental first step, which is bringing the nature of that disparity and the group that this disparity is happening to. um, we have to bring it to light, right? We have to collect all our healthcare quality information and then stratify them by race, ethnicity, and language. If you disaggregate your data, you know, like even all the ones that were required to collect, if we disaggregate them, then we begin to see where those disparities are, right? So you mentioned pneumonia. We did the work around pneumonia a few years ago, and this actually began by looking at our MUSE score for patient admitted for pneumonia. MUSE that stands for Modified Early Warning Signs. This is when you see someone who has maybe fever, and then of course other things like heart rate is high, temperature is high, and so it could flag yellow if there are two or more, or it could flag red if they are really high, like three and above. And These patients, when they flag yellow, is a warning sign that you need to go see this patient and care for them more intensely, right? And if it flags red, depending on the situation, patient may need to leave that unit and go to a higher acuity level of care. Now, what we found was the black population are not being escalated to a higher acuity level of care than the the Caucasian population, and that actually equal higher mortality, in this population when they're admitted with pneumonia. The other thing is that we found, which has nothing to do with this data, but is equally important, is that the African American population are showing up with complications about 10 years earlier than the Caucasian population. So bringing all this together, we were able to get this because we stratified that piece of data by race and ethnicity, right? So we were able to see the disparity in how we care for this patient. And then, of course, there is no blame game in this. It's just to create awareness that, do you know that this patient, first, when you see them, they might be 50 years old and the other person is 60 years old, a 10-year gap, but you pay attention to this 50 years old because they may be having more complication than you think. And so when they flag yellow or red, please escalate, the level of care. Um, and that's what we did, just kind of that nudge to change behavior and let people pay more attention, and of course the cultural humility to be able to ask those questions that really pertain to what patients need really made a difference. I usually say that you ask patient what matters to them instead of what is the matter with them. So this has actually made a lot of difference in the way we now care for these patients. The mortality has definitely gone down, and of course, we've seen deliberate attempt to escalate the level of acuity when these patients are admitted.
Dr. Jegede, obviously, I talk to providers, I talk to nurses all the time and about implicit bias or unconscious bias. And the thing is, we absolutely all have it. It has nothing to do with our expressed views. It just is a part of how we are. And we are, the more we know about that, the more we can get it under control, right? Most of us, I think about how many times I can drive 40 miles and not think about every single turn I'm taking. My brain is working efficiently, so I don't have to think about every single thing. But it also creates those situations where, no, I might not have an expressed feeling about Black patients with pneumonia, but there may be an affinity bias that makes me more likely to align with someone who looks like me if I'm a provider treating this person. So the thing I love about the behavior nudges is that it's simple and it gets right at pulling us back into our conscious mind and not letting that unconscious processing keep happening. So I love that. I love that something that simple can genuinely, literally impact people's lives.
And it's making impact in what we now call life expectancy, mortality in the hospital.
Yeah.
So definitely
Yeah.
great work.
And it is big work. You talked about this at the beginning. There are a lot of factors that impact a person's health. But we can't do it all ourselves. This work will involve lots of other people in the community. So we are hoping that lots of other people in the community are going to watch this. So can you share? You talked about the collaborations and partnerships that we need in the community. What kinds of
Yeah.
partnerships do we need if this is something that the community is listening to and we want them to hear it and go, oh, I can chip in on that? Like what kinds of partnerships do you see us needing to cultivate in the community?
Oh, this is a work that all hands have to be on deck. All hands. regardless of your expertise, it is needed, right? Um, from, like I said, faith-based organizations, all community-based organizations, uh, educational institutions, and everyone, healthcare institution, everyone is involved. Because not only about clinical care, but also these all social drivers that we mentioned. Of great interest to us right now is our collaboration with the Greensboro Housing Authority. And I'm excited about this really because this is a great way to reach those that will not be able to make it to us, right? They're not able to come to the clinic or to the hospital because of one lack or the other. So, for example, we were going to be helping the Greensboro Housing Authority is going to allow us to use a section of the building to provide digital access to our patients and those who have not been our patient, but they will be, when they are screened and found to have one chronic disease or the other. So really great way to, sit in your own house, probably just take a walk downstairs, see a nurse, and then be connected to a provider who will see you and give you recommendation of how to care for your health or give you some prescription for that matter. The other ones are, and this is really, really great. We have the Memorandum of Understanding that was signed earlier this year with NCA&T. We've signed one with UNCG, and also of recent is the one with City of Greensboro. These are huge, uh, piece of what we've been doing in the community. So I'm really so excited that our work is about to begin, and I cannot wait to see how we impact people's life positively, closing that life expectancy disparities in our communities.
Absolutely. And I think just with those that you touch on, it's all hands on deck. It's actually thinking about it's addressing transportation, it's addressing accessibility, even broadband access. All of that is kind of working. All of those partners are working in concert. Even workforce development, making sure that we have a diversity of providers in
Yeah,
our partnerships with the university. So it is exciting. It's exciting work that we are in a space to be able to do what we can do, and that we have partners in the community that are ready, willing, and able to do what they can and what they do best as well. And what more important work? Everyone should have access to the same possibilities and outcomes as it relates to their health status.
yeah,
And so that's obviously what we're working to make happen at the Center for Health Equity. Dr. Jegede, this has been extremely helpful, informative, and inspiring. Hopefully, there are a number of other partners that are listening to this and go, you know what, I think I can reach out and help on this. So I appreciate your time today and your passion for creating healthy communities. Thank you so much. Thank you for listening to Authentic Moments. To hear more episodes and receive information about our diversity, equity, and inclusion efforts at Cone Health, click the link to visit our SharePoint site.